The healthcare industry is changing, and that's evident to everyone, whether you're the patient, a clinician, or anyone on a healthcare staff.
Years ago, we did it all ourselves. When I first came out of residency, we were in the clinic, we went to the hospital, we came back out, we saw the patients ourselves. But now in the new system, the technology is enabling us to work as a team, so the specialist and the hospitalist can be an extension of what we do in our clinic, and when they come back to us, there's continuity of how we're taking care of the patient.
Integrated care involves team-based approach within Humana, so the care coordinators, the physicians, the hospitals, the specialists, and as primary care physicians, we're trying to be the center hub of that entire system to have a patient-centered medical home.
And this is where a big organization like Humana can help us organize the data so that when we're in real time with the patient, we have what we need to help the patient. We have options now. We can directly communicate with our specialists, and there is much easier exchange of information.
And so that helps with the coordination of care and then knowing after we refer, what their plan is, and that we can coordinate the medicine changes or anything that's happening to help the patients further their care afterwards. The pharmacy is very important for our patients. They can go fill their prescriptions at local pharmacies, but if they set it up with the mail order pharmacy, the convenience of having everything mailed to their house, it helps with the compliance issues, and then it helps us with the tracking issues too, and making sure nothing's interacting with each other because everything's getting filled in the same pharmacy. And we've started to have diabetic educators coming out to our office and meeting with the patients.
When you have a dedicated professional that has nutrition and also can work with the patient, that's going to empower the patient to understand how to eat, to encourage them to walk and get exercise. And as they start doing this, they start feeling better, and it's easier to motivate them to continue. In a small town, a lot of times our patients are not comfortable driving, especially to see a specialist in the big city traffic. Because we have the resources, we're able to go and be at the forefront, at the point of the spear of the change in medicine. Dealing with the insurances without the resources is difficult. But because we're in this system, we have the tools that let us practice cutting-edge medicine, take care of our patient, and use the new approach that a large organization can provide to us. So we're moving into better managing the overall health of our patients and in trying to prevent and take care of patients and keep them well as just the acute problem. But it's the people that make the difference, and we couldn't do it without working with the team.